I know it's a busy time of year for all of you, so the fact that you've taken some of your time today to join us, I really do appreciate it. We also are fortunate enough to have today a number of people who are new to ELDI, who have never attended one of our webinars today. And so just very quickly, because I know a lot of you are returning friends of ELDI, I just want to let everybody know that we have founded the ELDI because what we were trying to do here was to teach employees or employers to protect themselves, to follow what the laws are, and to be able to protect themselves in the event of liability. And so what we're going to do today, assuming that I can get my, I'm going to stop sharing my screen for 1 second because my PowerPoint doesn't want to advance. I'm just going to pause sharing for 1 second. Okay, sorry about that, everybody. So the reason we founded the ELDI was to protect our employers, teaching them how to be compliant with the laws that are out there, but also to be able to set and enforce their rules that they want to establish. And with that, we have the mission statement of ELDI and the guiding principles of our institute. And that again includes helping you to learn how to become compliant with the laws, but setting reasonable workplace rules so that you can control your workplace and operate efficiently. And hopefully the goal is that you don't have to focus all the time on HR issues because you're running a bit more smoothly. So with all of that in mind, what's our focus for today? How does today work into our guiding principles and our mission statement? We're going to look at policies that we should, after this crazy year, review for compliance. Some things we might want to change, some things you want to take a look at, but maybe you don't want to change them. So what do we have to deal with as an ongoing concern? We're going to talk about that. We want to talk about policy reviews for how you can control your workplace. So now that we've talked about compliance, what can we still do to control and operate the best for us? And then we are going to talk toward the end of our time together about some major changes coming to Pennsylvania wage and hour that we want our Pennsylvania Institute friends to be aware of so that you can plan appropriately for 2021. So for our first policy review, the first and I think most important policy for you to look at for the time heading into 2021 is your workplace safety policies. And so the part of the reason that we're really focused on this is that OSHA has really dug into COVID-19, and they have been very clear that COVID-19 is a workplace safety hazard. And so they're going to look at what employers are doing with regard to COVID. So in light of that, when you're looking at your handbook policies and you're thinking about what you might want to review for 2021, I think you want to put a general statement into your workplace safety policy that says that the company has established COVID-19 protocols and all employees are expected to follow those protocols, as well as any federal, state, or local laws related to safety in the workplace. And that is something that, to me, you really must put into your handbook. I think should you ever, God forbid, but should you ever have any type of an OSHA complaint or have to respond to anything, you want to be able to show that you have at least that statement in your handbook. And then you'll have whatever other safety protocols you have in place. If you want to do so, there's a list here on this slide of some other specific policies, things that you could include in your workplace safety policies on cleaning protocols. If you think it's important to set forth what your cleaning protocols are and you think they're kind of set in stone now, maybe you want to put that in. Hygiene protocols also could be important for you, particularly dependent upon the type of business you have. If you are going to mandate breaks for hand washing and things of that nature, you can go ahead and put that in your handbook if you want to, as well as specific personal protective equipment or PPE requirements. So if you know as an ongoing concern, masks are going to be a thing for you, you're just going to keep that in place, consider whether to put that in your policy, and we're going to get back to masks in a few minutes, as well as job testing or COVID testing as a job requirement. If for you, much like you have a drug testing policy now, if for you in the long term, you are going to require COVID-19 testing as a job requirement, then I suggest that you want to consider putting that into your workplace safety policy in your handbook as well, just so that everybody's on notice that that's part of your protocol that you're going to be using. So speaking of, where are we on testing? It changes so much, and lucky for all of us, a little more than a week ago, guidance just changed. So let's review, when we're talking about whether we want testing to be in our handbook, let's review where we are. So here's where we are. You are, as an employer, and this is unusual, but this is because of OSHA mainly, you are permitted to require that employees have to be tested before they can come back to work at certain points in time so that you can ensure that they do not pose a risk to the workplace. And that could be a situation, for example, before the employee starts work for day one, before they ever step foot in your workplace, you could require testing then. If somebody has been away on a long vacation, you could require testing then. Many of you have employees who do take extended trips to see family and things of that nature. You could determine that that's something you want to have in place. Or after someone has a possible work exposure, you could require testing then as well. That's up to you. You can also have a policy for testing that testing is going to be done routinely. You just have to ensure that it's done in a fair and consistent manner by groups of employees. What you don't want is to be picking and choosing employees that are going to be tested, because you're just bound to run into a situation where someone claims they're being, quote, picked on. So if you're going to ensure that all employees in a certain department are going to be tested routinely, that's completely fine. I have clients who are involved in the manufacturing of certain component parts that will be part of vaccine distribution, as an example. And so for that particular employer, everyone who works in the plant is getting tested weekly, whereas their administrative people are in a completely separate area and they don't extend that weekly testing requirement. So those are the types of things you want to think about as maybe a way to delineate who would be tested and who would not. And if you as an employer are going to require routine testing, you should pay for that. So when we last spoke in, I think it was May, and we were doing our return to work ELDI seminar, one of the things that we talked about then was that there were certain insurance waivers of testing costs and things like that. And that was in large part because it was funded in part under the CARES Act, which we talked about at length back then. But now what's happening as testing has become more readily available, et cetera, what is happening is that employees do have to pay, particularly if they have a high deductible plan. They have to pay, and it is, it is expensive. And so if you are going to mandate routine COVID-19 testing, just like you do with drug testing, you want to pay for that and make that part of the policy. You may run into employees who claim that they have a religious or disability objection to going and getting tested on a periodic basis. And so what you have to do in that situation is consider whether an accommodation needs to be made. So you would sit down and you would talk to that employee about what is going on, what is the reason that they feel that they cannot be tested, and consider whether an accommodation is necessary. So if someone has some sort of a disorder that precludes them from doing it, you can ask for evidence, you can ask for certification that this employee really shouldn't be tested unless there's some symptoms or something like that, and you could make an accommodation. And just remember, as we're talking about testing policies here, that privacy rules still apply. So you can't disclose, this is under HIPAA, you can't disclose that someone's getting tested or that someone has tested positive. So you just want to bear that in mind. Following testing, where are we on quarantines? And this has just been updated effective December 2nd. So we've got some new guidance on this. 14 days is still the recommended quarantine period. So that hasn't changed. However, here's what has changed. There is new guidance for asymptomatic employees. So I want to be clear that this guidance that we're going to talk about right now, these new standards apply only to asymptomatic employees. But here's what you can do. Employees who have been monitoring, they've been quarantined, they've been monitoring their symptoms, they're 10 days out, they're in quarantine for 10 days, so they're 10 days into this, they still don't have any symptoms, those employees can return to work even without getting tested. Or if you have an employee who, again, they're quarantined, they've been monitoring, they don't have any symptoms after 7 days, and they have now gone and they've gotten a negative test, and the test sample was taken on the 5th day or later of quarantine, as long as they come out negative, obviously, after the 7th day of quarantine, they can return to work. So that is a big, big change. They should still check for symptoms, wear their face mask for 14 days, or permanently if it's required by your business. This is a big change. And the reason for this big change is the paid sick leave is ending effective 12/31. We're going to talk about that a little bit more in a minute. But as paid sick leave ends, there's been a lot of talk about how can we allow employees to return to work safely, but earlier, so that they miss less time away from work. And for you as the employer, part of the reason for this also is you get your workforce back just that little bit earlier. So it's kind of a compromise where we know more now about COVID. We're seeing how people react. And so we're taking that experience with asymptomatic employees and kind of putting it together to give more flexibility for employers and employees. If you have currently just a standard 14-day quarantine policy, and a lot of people do, and if you would consider and move to this for your asymptomatic employees, my suggestion, not the law, but my suggestion would be consider announcing that this is what you're going to do, but give it a week or 10 days so that people can understand and feel comfortable with the change. Because some employees may not, and they may have questions for you. So before we start simply applying that, I think I would give a heads up if you intend to take advantage of this new guidance that has come out. Contact tracing, where are we on that? As we're looking at our workplace safety policies, contact tracing is part of that. So where are we? So if you become aware of a known exposure at work, you've got a particular employee who is tested positive, we go through and we look and we figure out who that employee has been exposed to and send all of those exposed employees, we'll call them, you send them home. How do you determine who's been exposed? We look at a close contact analysis, and whoever has been in close contact with an infected employee is going to be who we're going to be sending home. And as you see up here on the screen, the CDC has come up with what it calls its 6-15-48 analysis for determining close contact. And that means that this employee, who we're now calling the exposed employee, has been within 6 feet of an infected person for a total of 15 minutes within 24 hours. And I want to stop here because this is a change. So earlier, months ago, the standard was that you had to be with that person for a continuous 15 minutes or more. That is not the standard now. It is 15 minutes over a 24-hour period. So in the course of a workday, let's say you've got 2 employees who are working together on a machine, and they're together within 6 feet for 5 minutes here, 5 minutes there, 10 minutes there. You add that up over the course of one shift, and it's more than 15 minutes. And so that meets the 15-minute standard, even though they haven't spent 15 minutes together at any one point in time. So it's a big change to be aware of. And then the 48 part of our exposure test is you take a look at, if you've got a person who's showing symptoms, you take a look at somebody who's met the 6 and the 15 component within 2 days before the employee started showing symptoms and until that person was quarantined. If you've got an asymptomatic person who tested positive, you look at who met the 6 and 15 components within the 2 days before the asymptomatic person was sent for testing and until that positive person has been quarantined. So that's how we determine who has been in close contact and then who is going to be, quote, contact traced for that particular employee. Once we do have a positive test, where are we on our post-positive testing protocols? We do the contact tracing to see who's been exposed, as we just talked about. That's step 1. Step 2 is you want to disinfect the infected employee's work area. So if they work in a particular lab, for example, you want to really heavily disinfect that particular area. If it's a retail employee, maybe they work in a specific department, you want to heavily focus on that department, etc. If someone was a server in your restaurant, kind of hard to pick a particular zone, but if you can, you want to more heavily focus on that, but you're going to still increase your sanitization of the entire work area. Most importantly, your high touch areas, door handles, light switches, copiers, things of that nature. And you want to reinforce your protocol for employee hygiene. You want to reinforce hand washing, that employees have to wear masks, things of that nature. That use this as a time to take stock and make sure you've got enough PPE around and that you've got enough hand sanitizer around and that you've got sanitizer, soap, etc. out and available at no charge to your customers, to all of your employees, etc. And you just want to, again, take it as an opportunity to reinforce the need for sick employees to stay at home. So those are the things that we look to do after we've had somebody test positive in the workplace. Keeping employees from being positive, maybe we turn to the next issue, which is where are we on employee health screenings? What are we allowed to do? So as you heard me mention earlier, OSHA has really taken a very different approach to COVID-19. OSHA has been very clear that it considers COVID-19 to be a safety hazard in the workplace. And the EEOC has also changed its view. So those of you who are, long-term ELDI members, we talk all the time about the EEOC trying to keep out of, private employee health business, and you only get what you need to know and all that type of thing. But the EEOC has taken the position that employers are allowed to ask questions of employees that get to whether or not they could possibly have COVID-19. So this is a big shift for all of us. And by the way, not an across the board shift. The things that we are talking about in terms of health screenings relate to COVID. This is by no means an open invitation, nor would you accept it if you could get it, to start asking more questions about employee health issues. So I just want to be very clear that this is a huge difference in treatment, and it is not a change for everything, and we don't want it to be that way. So what are we allowed to do? The permitted screenings, as opposed to what you're obligated to do. Now, some of you are required to do certain things because of your business. But as a general matter, here's what you're allowed to do. 1, you can take temperature checks, and many of you are doing that. 2, you can do self-monitoring and reporting. There are apps now that allow employees to monitor their health. They can send you results, they can self-report results, or you can do daily questionnaires. You can have employees when they come into work, you could have visitors when they come into your office. They can fill out forms that say, have you had a fever? Have you had loss of taste or smell? Have you had, a sore throat? Things of that nature. Understand, if you collect this information, it is a medical record and it is protected under HIPAA. What does that mean for you? Obviously, it means you're not running around the office telling everybody what's on somebody's form. I think that's self-evident. You all get that. However, what it also means, particularly for those of you who are the true HR people and you maintain personnel records, these records of these daily screenings are separate medical records that cannot go in personnel files. You've got to keep them in separate files. They have to be kept away from where anyone generally can get to them. If you store them on your server, they should be at a minimum password protected so that they are not generally accessible to anyone with downtime who feels like checking to see whether so-and-so had a fever today. And unfortunately, I think we all know that we have employees who do that. So we want to be very careful to protect this information once we do collect it. You cannot, and we mentioned this before, but it's extremely important, and I know a lot of you are dealing with this, you cannot reveal the identity of someone who is tested positive or someone who is going to get tested or someone who has been exposed. And I say that, but I want to stop because it is extremely important. And I know a lot of you are dealing with this because you get a test result. Somebody in your office tests positive. And then everyone and their brother wants to know who it was. And they come to you and they say, gosh, I'm so concerned. I don't want to get it. Or I live with my grandmother and I don't want to risk giving it to her, et cetera, et cetera. And there's a lot of pressure. I mean, I have some clients I've talked to over the course of a week about an employee who tested positive and everyone wants to know who it is, et cetera, et cetera. So my suggestion is that you do two things. Number one, you reinforce to the employee who's asking you who it is, that if they have been deemed exposed under that 6, 15, 48 analysis that we discussed, if you had been exposed that way, we would have let you know. That's the first thing I would do. The second thing I think it would be important to do is to say the following, and this is how I've ended discussions about this in the past several months, is to say, look, if this was you and this was your family, you would not want me discussing that with anyone who came to me to ask in the office. So let's extend the same courtesy to that other family. And please understand that if you were exposed under CDC guidelines, we would be telling you that. We still wouldn't tell you who it was, but we would tell you that you were exposed. And hopefully between those two things, you can stop employees from really pressuring to know. Sometimes they may be able to figure it out, but not because you went around and said who it was. And I think that's just really very important for you to keep in mind. And finally, if you're not doing screenings now, but maybe you're considering doing screenings for some reason, maybe because tests, positive cases have increased and you're just getting a bit concerned, think about it before you start requiring screenings. Many of you have to, and that's just a different issue. But if you don't have to do it, just think about how your employees may feel about it. Some of them may, feel that they're being, in their privacy is being invaded, and they're getting that a lot in other places. Think about whether it's really necessary for you when you're already stressing the use of PPE and you're already stressing that sick employees should stay at home. You may come to find out that through using some of these screening methods, you're going to uncover health issues about other employees that they really want to keep private. And so I just say to you, if you're not required, just think about that for just 1 minute before you start. Maybe you decide you want to test anyway, or do these daily health screenings anyway, but I just point that out to you. Masks. They're mandated for much of Pennsylvania and New Jersey, but I want to take a minute here when we're talking about our workplace safety policies to think about masks for 1 minute. And this is not about whether to wear them or not. That's your decision. Sometimes that decision's taken from you because of the nature of your business. I want to talk about a different aspect of masks that I think is often overlooked, but is extremely important to you. And that is the following. Employers may want and have to have available to their employees masks. So if masks are required, whether by law or because you want them in your private business, you have to be prepared to provide them at no cost for your employees, and that's fine. You have to consider the issue of, do you want to mandate that employees wear the employer provided masks? And here's why I bring that up. First, you want to think about masks that have messages on them. So when this all started and we were getting masks, many people just got a basic nondescript mask. And then people started getting just solid black masks. Fine. But we live in a capitalist society, so what do you see being sold everywhere? Masks. And you see masks with messaging. Sometimes you might just see a mask that has, you know, Merry Christmas or a picture of the Grinch or something like that. Okay. But there are other masks that are readily available and that many of your employees may have that have messages on them. And it could be a benign message, have a great day or smile, or it could be a political message. And this is not about whether you agree with the political message or you don't agree with the political message. It's about, do you want to be the referee of what messages are okay or are not okay in your workplace? And I suspect, although I can't see everyone here, I suspect that many of you are shaking your heads and saying, no, not me. I got enough to deal with and it's open enrollment. No, thank you. So I really strongly urge you to consider banning any masks that have any kind of messages on them at all. I would ask you to consider, you do not have to, but I'd ask you to consider maybe you have an employer provided masks. The one thing that I have seen a lot of being out and about is masks that in businesses where everybody has the same mask and maybe it just has a company logo on it. I was out somewhere not too long ago and somebody, it was a server, had a mask that said, remove in case of bourbon. And it was cute and it was funny and it was employer issued and it was great. But if you don't want to become the arbiter of messages on masks, I would strongly urge you to consider either just requiring employees to wear employer provided masks or just say no masks with messaging or pictures. So just something to think about that I really don't think is being addressed very much. You do also want to ensure, if you have a mask policy, that the mask meets your safety standards. That some of you may be okay with gaiters that somebody can just pull up over their nose and their mouth when they need to. A lot of my contractor clients, that's what they use for their people because they're usually in a place where they have to have other equipment on or they're by themselves, and the gaiter really works well for them. But other people want a mask with ear loops that covers the nose and the chin, whatever it is, just make sure that the mask meets your safety levels and that they're clean and that they're not damaged. You want to consider if masks are going to be an ongoing requirement for you, whether you update your dress codes. Now, many of you have in a dress code that the employee must wear the employer supplied uniform, and that's probably okay. And if you supply the mask, would include the mask. So probably okay if you do that. Otherwise, you might want to think about updating your dress code to say that a mask will be required that meets the employer safety standards and include in there about no messaging on the mask. So something to think about with regard to masks. And you do want to definitely include a statement, if you are going to include masks in a policy, that you'll consider reasonable accommodations where that is necessary. Because again, as we talked about a little earlier with regard to testing, you know, you are going to have, as you see here on this slide, some employees who cannot wear a mask. There may be disability reasons, there may be religious reasons. So for example, you could have an employee who just has a respiratory issue and they can't wear a mask. Maybe you want to consider a face shield for that particular employee so they don't have anything that's fitting over their nose and their mouth. If someone is permitted to take breaks throughout the day to pray, for example, you might accommodate that employee if they say that they can't wear a mask during that, to say, okay, you can do that, but you've got to socially distance. You have to go to, you know, a location where you're not within 6 feet of anyone and it can only be for a certain amount of time. That's what I mean when I talk about accommodating. It doesn't mean that somebody, particularly this religious issue, doesn't mean that they don't wear a mask at other times, but we're accommodating that reasonable need after discussing it. with the employee. Before I move on to our next policy, which is telecommuting policies, does anybody have, or Danielle, are there any questions about our workplace safety policies?
There are two. The first one is more of a comment. In a small company of seven, everyone knows who has tested positive. There's no way of keeping it private.
I agree with that 100%. You are completely right. It is a fact of the way things go. It's just you don't want to be the one who is saying it was Mary who tested positive. You're 100% right. People are going to figure it out. I realize that, and I think it's the flaw in the plan, quite frankly. Because of how far these protocols go, it is going to be obvious. You're right. Nothing you can do about it. But as long as you're doing your part to maintain confidentiality, that's the best that you can do in that situation.
Next question. This is a two-part question. If we are paying for employees to get tested, are those cost tax write-offs? Are the PPE that we purchase and provided write-offs?
So I am not an accountant by background, so I will try to stay in my lane and just say, you've got to ask your accountant. It seems to me it's a reasonable business expense, but I don't want to step out of my lane. And I would say that you've got to ask your accountant that question. So I unfortunately am going to have to defer on that one, but it's a good question because it's a substantial business expense for many of you. Okay.
We have a couple more.
Oh, I'm sorry. Go ahead, Daniel.
Any word on extending the CARES Act after December 31st?
So the CARES Act included a number of things. And yes, there are parts of the CARES Act that they're talking about extending, but I want to make sure that we're clear on what the CARES Act is and isn't. So one of the things that we're going to talk about in a minute are the paid sick leave and the emergency family leave. Those things were not part of the CARES Act. They were actually part of what's called the Families First Coronavirus Response Act that actually was enacted just a couple of weeks before the CARES Act. Those two things, the paid sick leave and the emergency family leave, they are ending 12/31, and there's no discussion right now about extending those. The CARES Act contained a number of different components. And as it relates to how we deal with employees, the two big ones are the extended unemployment compensation benefits and the paycheck protection loans. There is discussion about reopening the PPP loan applications. There's still a substantial amount of money left in that fund. I think the last I heard it was like $130 billion left in the PPP or Paycheck Protection Program. That fund, so there is discussion about opening that. There is also discussion about extending some unemployment benefits. So we don't have a deal on that yet, so we don't have answers, but that is being discussed about. However, the paid sick leave, the emergency family leave, that is not on the table that I have heard at all. So that's where we are there.
One more question. This one is, two more questions, but this next one is two parts. How should we be tracking contact tracing? Can we still require asymptomatic employees to obtain negative testing before returning to work?
So contact tracing, again, you can just keep records of your 6, 15, 48 analysis. So you will know who the employee is who has tested positive, et cetera. And then what you're going to do, however you choose to do it, email documentation, Word documents, the logistics of it are not necessarily as important as the fact that you have it. Just have some way that you wrote down, okay, the infected employee is John Smith. Their last day in the office was 2 days ago. This is when they tested positive. This is who worked with them. And whatever your notes are, it's like show your work in math class. And then once you do that analysis, put it in with those medical records that we talked about. So you're going to keep it in a separate file. It can't go in John Smith's personnel file, but keep it. Because if in the event, OSHA comes back and says, hey, one of your employees complained that you didn't really contact trace when you had somebody who was infected, you're going to pull out your notes. And I don't care if they're in a composition book, I don't care where they are, but you're going to pull out your notes and you're going to say, this is what I did. Here's who it was. This is when I learned about it. This is what I did. You can show your work, just keep them in a separate place. The question about can we require negative tests before somebody comes back to work? You can. The trick is, when is an effective negative test going to take place? And there very likely is going to be some amount of quarantine that would be required before a negative test has any value. So just like we talked about with our asymptomatic employees, we talked about how somebody could quarantine for 10 days and not test and come back. Somebody could quarantine, get a test after the 5th day and come back. You really want to look at that type of an analysis, because let's say you have someone who's infected on a Monday and you determine who's been exposed, and you know they're going to go get a negative test on Wednesday. That's probably not good enough. So you've really got to look at exposure and kind of put it together with time out of work as well. Now, to the extent the question is talking about somebody has gone away on vacation, like we mentioned earlier, or you know somebody maybe had to go see a family member or something like that. Yes, you can require employees where you've got, I'll use the phrase that many of us are familiar with, reasonable suspicion. You have some reason to think they need to be tested, that's fine. But the downside to doing that is you got to think through who you're asking to have test before they come back. So let's say, for example, somebody goes to Disney World for 2 weeks and they come back and you say, no, you can't come back until you get a negative test. You can do that, that's okay. But two things with that. Are you doing it with everybody who travels and comes back? Are you only doing it because it's Florida? Does that employee happen to be in a protected class? And are you going to pay them for the time? Are they going to have to use, you know, PTO? There's a lot of things for you to think about, as well as when are they going to have to test? So are you going to say, okay, you went to Disney World for 2 weeks, you came back on Sunday, you've got to quarantine for 5 days, then go get a test, and if that test comes back negative, then you can come back to work. That's okay. You can do that. But you just want to think that through, because bottom line is we can't stop employees from taking vacations and things like that. So you can require it. You are allowed to do that. But you just have to think about all the ancillary things that go along with it. And you may still decide you want tests. That's okay. But it's just about thinking about the other things that could ensue before you actually make that decision. Danielle, do we have any other questions?
2 more questions.
Okay.
Where are employers able to send employees for testing if the employer is paying? When we have looked into this in the past, we were told the only way to get a test was with a doctor's note or a doctor's script or a CVS type location, which now is testing times 3 weeks away.
So those are the main places. A doctor's script typically is going to be very difficult to get, and you're 100% right that several months ago, that was the only way really to get the test. CVS, Walgreens, those types of places, Patient First, all those urgent care centers, they do COVID-19 testing. You can send them there. I do know it is true that there are some backups at places like CVS, those types of things. But those are really the main places. I am assuming, but haven't checked, that a Quest lab would do so. But admittedly, I'd have to check on that. But if that, you know, that's where you send people for drug testing and things of that nature. But there are a wide variety of places. Admittedly, some of them are difficult to get to. Some of them are backlogged. Some of them are opening more testing times. Now the cases are rising. So that is something. So for example, I am aware of a CVS in my area that had, I believe, a 1-week delay in being able to get an appointment for that testing. They ended up getting more staff to do the testing, and they opened more testing availability. But those are the types of places. But it gets to a really good point, and that is, if you're going to be requiring testing, is it feasible? It's a great question, because we all say, oh, get a test, and tests are readily available, but it is not as easy as it seems. So if you were going to require tests and it's not on a medical necessity, you might want to think about how readily available it is in your area. So it's a great question. Anything else, Danielle?
Someone made a suggestion for this question that they use WorkNet at $200 a test, and usually same day results in 36 hours.
Okay, that's great. It's expensive. That's an expensive price, but it's a great idea.
We do have 2 more questions.
Okay.
If someone has potential exposure to COVID, but are awaiting someone else's test results, what are we allowed to ask for as proof of that?
So if their exposure comes from someone else's test result, it's really difficult because you cannot ask to get that other person's test result. They're not your employee. And so it's a little bit of trust, and admittedly difficult, but you're not going to get your hands on that unrelated person's test. So that's, unfortunately, if that is the basis for exposure, you have to take the employee's word or make a decision about how long you would like your employee to quarantine, or when you would like your employee to just get a negative test. So your options are, since you're not going to get the third party's test results, your options are sending your employee for testing and deciding when you want them to do so. And that's typically, you're going to do that on the basis of talking to your employee and seeing when they were likely exposed. Or you can say, hey, quarantine for this, get a test here. You're going to come up with something that you feel comfortable with. And that's what you're permitted to do. But you're unfortunately you're not going to know for sure what happens with that third party. Was there another part to that question, Danielle?
Last question.
Okay.
Should we begin contact tracing once someone is suspected with COVID, or wait until the actual positive results are rendered?
That is a great question. I think that the best practice is to announce a potential exposure to the people who would meet that 6-15-48 analysis. And then you can always kind of take it back and say, all's clear, come back to work. But if you start earlier, when you're made aware of a potential exposure, you can kind of move through it a bit faster. You can ask employees to stay home, always can call them back. But if they are going to be in a position where they need to quarantine, you don't want them exposed to each other all day, every day, until you find something out more definitive. So if you become aware of the potential exposure, do your contact tracing then, even before you've got your affirmative test, and decide once you get the test what you need to do. Okay? All right, so let's move on to telecommuting policies. This is a big one. And we used to not talk too much about telecommuting policies in the pre-COVID era because, some people did it, some people didn't, etc. But now you've had state guidance that has said you should, and I emphasize the word should as opposed to must, should permit telework where it's possible. But you've got to decide, and you've got to make a conscious decision for your company whether or not you're going to continue telecommuting or you're not. So here are some things that I think you should consider based upon what we've been seeing. Non-exempt employees, that means employees who are entitled to overtime if they actually work over 40 hours in a week. They still have to record their hours worked. They have to record when they go on a meal break and things of that nature. And your supervisors are going to bear the brunt of this. So they've got to make sure that employees who are now telecommuting are in fact tracking their time. They've got to track the performance of those employees who are teleworking. And they have to ensure that those people are actually working, which is unfortunately a problem that we're running into with work from home. Employers do have the right to expect the most efficient form of work. So whether or not it is possible for you to give someone a computer and have them work from home, that doesn't mean that it really works for your business. And you have the right, and remember, this is what I talked about earlier, we're all about what do employers have the right to do. You have the right to decide how and what is best for your company. So you want to consider whether or not a policy of telecommuting beyond this pandemic opens you to something else. And this is the crux of telecommuting policies. So it is one thing to have a telecommuting policy while we're in the midst of COVID. That's one thing. It's been encouraged by the state, things of that nature. However, The longer you continue telecommuting, especially as restrictions are eased and more of us are allowed back into offices and things like that, the longer you permit telecommuting or teleworking, the more you open yourself to having to allow telecommuting when somebody has an issue and they say they can't work in the office. For example, somebody has to go out for surgery and they're going to be out for 6 weeks and they say, don't worry, I won't have any downtime. I'm going to work from home for that 6 weeks. And you say, oh my gosh, how are you going to do that? It's very serious surgery. You're not really going to be able to work. I don't think that's a good idea. And the response you hear is, well, you let us work from home for months on end with COVID, so why can't I do it now? Are you saying you're not going to let this happen because I'm disabled? And here we go, right? So you really want to think this through, because it has been the case pre-COVID, this has nothing to do with COVID, that when employers allowed employees to work from home because, hey, let's let people work from home on Fridays in the summer, that's a great perk. The EEOC turned that into, well, if you can allow it on Fridays in the summer, guess what? You can allow it as a reasonable accommodation. And you can see this happening when you have employees who have ongoing conditions. For example, let's say migraines. Somebody has migraines and they say to you, I get migraines once a week and I really want to be able to work from home on my migraine days. And you say, gosh, you know, my son has migraines, my mother has migraines, and they're debilitating. And I know for a fact that when my son or my mother has a migraine day, they cannot be in a room with light, much less be sitting in front of a computer. So I don't think that's a great idea. And then you get the same argument. But wait a minute, I was able to work from home during COVID and you never had a problem with it then. So is it just because of my disability that you have a problem with it now? And here we go. So you really have to think about telecommuting, because it can open a door to things that you do not want to deal with in the future. You do risk facing discrimination claims if you're picking and choosing who can work from home. So for example, had this situation. Employer wanted to grant work from home privileges to an employee who had worked for the employer for 20 years. They were long-term employee, well-trusted, demonstrated, you know, that they were a hardworking employee and they wanted to work from home to eliminate their commute time because this particular employee was caring for a husband at home who had a nurse during the day, but the nurse needed to leave. So, okay, we were fine with that. Now we have another employee, same employer, new employee comes and says, gee, my commute's over an hour a day. I'd really like to work from home 1 day a week. And we say, okay, we've got to train you because this person was new to the industry, but after 90 days, assuming it's going okay, all right, we'll let you work 1 day a week from home. And then the employee comes after the 90 days and says, gosh, I'd really like 2 days a week at home because I want to go to my son's football games. And the employer says, wow, boy, I don't know about that. That's a lot. And the employee says, well, you let so-and-so. What's different with me? And it just so happens this employee I'm talking about with the son is in a protected class. And so now we risk a discrimination claim. So if you're going to allow telecommuting, you have to really think about who is going to be able to do it. What is the criterion? Because you could end up with a discrimination claim out of it. Also extremely important to consider is the security of your information. Do your employees have access to your financial information if they're working from home? Is your network secure? Because now you're going to have people on possibly open Wi-Fi networks accessing your servers and your systems. So is the employee's internet secure that they're using to access yours? Or are they like stealing their neighbor's unprotected internet, or they're going to Starbucks and they're using, you know, open public Wi-Fi? You know, you have to think about those types of things. What about your employees who don't want to have the internet in their home? What about your employees who can't afford the internet or don't really have good internet available in their neighborhoods? Are you going to allow them to have printed materials at home? Those types of things. What happens if an employee resigns or they're terminated. If you're letting them work from home and they've got your information, how are you getting it back? How do you know that you can get everything back quickly? You want to think about that. Another important point is don't assume that everybody wants to work from home. There are many people who have jobs because they don't want to be home all day. So we don't want to just assume that everybody loves working in their sweatpants. Now, many of us do, you know, you can't maybe see my hand raised, but many people just don't want to work from home. So you don't want to make that assumption that you're doing them a favor by letting them work from home. And then the other thing to think about if you're going to allow telecommuting or work from home on an extended basis is, what if somebody doesn't perform well or they're suspected of stealing time from you? Are you going to be able to confront that person and deal with it? And you're probably sitting there saying to yourself, yeah, Kim, duh, no big deal. I'll just say, hey, you can't do this anymore. But believe you me, from experience in talking to clients, it is far easier said than done. Many clients do not want to have that conversation with their employees. They do not want to be confrontational like that. And so think about whether you're really going to be okay with ending that policy for somebody, because it's like any other discipline situation. Many of you don't like to do it, and I understand that. So it's just something you want to think about. Workers' compensation claims, crazy, but remember what workers' compensation is at its heart. It's if somebody gets hurt while they're working for you, and it doesn't matter where they are. If they're working for you, they have a claim, and you're on the hook unless you can prove that something it didn't happen on their work time. So what happens when somebody gets up from their dining room chair to walk to their printer and they trip over the cat or the cord? They've got a workers' comp claim because they were working for you, even though it's in their own home. Or what happens if somebody doesn't have, you know, an ergonomic chair or something like that at home? They end up with a back problem and you've got a workers' comp claim. So you want to think about that as a consequence of extended telecommuting or work from home as well. If you do decide that you're going to discontinue work from home, you've had enough, there's a lot to it, you just don't want to deal with it anymore, there are two suggestions here for how you can issue a statement that you're ending telecommuting. First, you can just state that we're returning to our prior policy of no work from home. If that was your previous policy, you can just simply state it. It's that simple. An alternative is to say, we've determined that the company's operations don't benefit from work from home, and that we've decided that it's in the best interest of operational efficiency for the company that we're going to discontinue work from home privileges. Those are a couple of ways to just end telecommuting. And if you choose to end telecommuting, you want to ensure that all the materials that you have out on the street now, because you did that for COVID reasons, you collect everything and get it back into the workplace. You don't want people keeping that random manual or that set of financial reports at home. You want to get everything back so that you know that your information now is all secure. And you do want to, if you're going to discontinue telecommuting, you just want to reinforce to your employees that you are taking continued steps with COVID protocols in the office. You're cleaning, etc. PPE will be provided for people, etc., just to make them feel a little better. If you decide on the flip side, you know what, I'm okay with work from home. It's worth it to me. My employees really like it, and I'm going to continue it. A couple of things for you to think about. Number one, you want to clearly define which employees are going to be permitted to work from home and not. And you have to have a very legitimate reason for making that distinction. It might be that office employees are allowed, but not plant employees, something of that nature. So that it doesn't have the effect or the look of being discriminatory. You want to set forth very clear expectations for your employees if you're going to allow telecommuting, how they're going to track their time and their productivity. What is their work from home schedule going to be? Is it going to be 5 days a week, 3 days a week? And remember, you set that schedule, not them. So if somebody comes to you and says, I'd like to work from home every Friday, or I'd like to work from home every Tuesday because my son has baseball practice and it'll be easier, that doesn't mean that's what they get. You can say, we're taking a look at the schedule. We've obviously got a lot of big picture issues to address when we decide what the work from home schedule is, but thanks for telling me, and I'll see if I can include it, but I can't guarantee it, okay? So just remember that. Participation in meetings. You may say that, okay, you're going to be working from home, but we're going to have a daily kickoff meeting at 9 o'clock, or we're going to have a daily roundup meeting, or both at 4 o'clock. And that's what we're going to do. You have to be able to and say that you're going to require in-person attendance as needed. So maybe all of your office administrative staff is going to work from home, but you do inventory in January and everybody must be on site for inventory. Or you've got an accounting firm and everybody's got to work in the office during busy season. And then after that, we'll resume, work from home where needed, etc. Make sure that you retain the right to revoke your work from home policy or discontinue it at any time for any reason as determined in the company's discretion. You want to make it clear that telecommuting is a privilege and people don't have a right to work from home, particularly if being in the office all the time or part of the time is an essential function of the job as you have determined it. Now, I'm going to get to very quickly, but this is, those of you who are regular ELDI attendees, you know that I'm all about job descriptions. This is something you want to have in a job description. So if attendance at the work site is important, put it in your job description. And then maybe if you require physical attendance, you shouldn't be allowing telecommuting. So you just kind of want to think about that. You may also want to decide that you're just going to allow telecommuting during the COVID-19 pandemic, and you're going to either end that policy on a certain date, and maybe you can revise the date later, or once an end is declared to the pandemic. So you want to think that through as well. Sick policies, and I'm moving along a little bit because I know we're tight on time and I really do want to respect everybody's time here. So I'll hold the rest of the questions until the end for anybody who's able to hang on. So I appreciate it and sorry, but that's, I think, how we'll try to move through. Sick policies, updating those in the post-COVID era. The COVID-19 has made your sick policies a little more difficult to administer because you're telling employees if they're sick, they should stay home, and you're relying on them to be honest with you about it. And as we've talked about, OSHA is requiring that you maintain safety standards related to COVID, and one of those is that you keep sick employees home. So you can't allow employees with symptoms to remain in the workplace. You find yourself needing to err on the side of caution so that you don't buy yourself a different type of problem. And you can't take disciplinary action against employees if they either have to go for a test, if they have symptoms, or if they, certainly have to quarantine. The exceptions are if you have evidence of dishonesty, which I have had those instances. I had somebody who thought that it was okay to post on Facebook that they were on vacation while they told us they were quarantining. So that employee no longer has a job. But something short of that, you really, have to take the employee's word for it. And the paid sick leaves that I mentioned a minute ago in responding to somebody's questions, those policies are ending in 2020, or effective 12/31/20. So they're not in play in 2021. So I don't suggest that you add them to a handbook because they're going to be gone. Time does not carry over. And as I said, there's nothing that we have right now indicating that that's going to be extended. So what do you do with your sick leave policy? All that having been said, do you update them? Do you change them? Not necessarily. And here's why I say that. Many of you have spent years developing your sick leave policies. Some of you have point systems, some of you have occurrence rules, etc. And you've tweaked them a lot over the years as employees kind of figure out how they're going to work around them. So I don't necessarily think you should change your sick leave policy. If you're in Philadelphia or New Jersey, there are paid sick leave laws. Make sure your policies comply with that. But otherwise, keep your sick policy. And if you're going to discipline somebody under a sick leave policy, think about whether COVID comes into play and exclude COVID-related illness issues from your consideration. So if somebody was out 6 times sick and only 2 of them were COVID, and now they violated your sick policy, that's different. What if an employee just refuses to return from fear of COVID? Well, figure out first if it's a disability issue, because if it is, if they've got, say, COPD or something, figure out how you can work out an accommodation. That doesn't mean they don't come back to work. It could mean that maybe you give them additional PPE. Maybe you move their desks so they're further from people, things of that nature. See if you can provide an accommodation. It doesn't mean that somebody doesn't come back to work, but you have to work that through. You engage in the interactive process that we talk about an awful lot. And it's called interactive for a reason, because you, the employer, do it plus the employee. So there's lots of things that you could talk about as accommodations. You could alter start times. You could say that employees who have to attend meetings, even if they're in the office, they could dial into the conference room, so they're not sitting in a conference room. You know, those types of things. So you don't have to necessarily accept an accommodation that is demanded or requested by an employee. And remember, you can request medical documentation about the need for an accommodation, even if it's related to COVID. Okay. If somebody says to you, gosh, I don't want to come back, or I have an issue because I have a family member who's at higher risk. First, figure out if they need to care for that person. Because if you're an FMLA employer, you've got 50 or more employees, if they need to care for an ill family member, they could be entitled to FMLA. But this is very important to remember, that if it's not that type of situation, the Americans with Disabilities Act does not require you to accommodate an employee who is not disabled. So if a family member of an employee is disabled, but the employee is not, there's no accommodation under the ADA that needs to be made for that, okay? Employees who don't have a physical reason, a mental reason for not wanting to come back to work, but they just don't want to come back because of COVID, they're just afraid of COVID, those employees are not protected. You can ask that they return to work, and if they don't, they may not be eligible for unemployment. And we have dealt with this a lot. We dealt with it a lot in the summer when that $600 extra a week was in play for unemployment benefits. Everybody was, quote, scared to return to work. So I suggest, and we've done this many times, that you just advise employees who are in this situation to say, look, I understand it's a scary thing. A lot of people don't like it, and I understand and I hear you. However, I have an obligation to report honestly to the Unemployment Compensation Bureau why you're not employed. And I can't say lack of work because we have work for you. So if you don't want to return because of COVID, I'm going to have to report that we have work for you. You're not ill, but it's that reason, and you may not get unemployment. And that typically resolves the issue. You're being truthful, but you're doing it in a more empathetic way. So similar to sick policies with your attendance policy, should we update those? Not necessarily, but if you're going to take disciplinary action because of an attendance issue, just think about whether COVID came into play. Because again, we can't take disciplinary action based on COVID-related reasons unless we know that there's abuse. You still, however, should require, just with sick policies, require that employees follow your call-out procedures. So if they're supposed to be in work at 9 o'clock and they're calling you at 10 o'clock and saying, oh gosh, I think I have a fever, I'm not coming in today, that's a separate violation. That's not a COVID issue. That's just a violation of the attendance reporting. And that is something that could be actionable if it happens enough times. Employees who refuse to test, we've talked a very little bit about this, but for employees who refuse to test and you're requiring it for everybody or they've been exposed, again, I think that you can require them to stay home. You can require that they quarantine, and they're not going to get paid for that unless they use PTO to cover that time, which you can require, and that's okay. So you just want to be mindful of that. So those paid leaves are ending. It's very important. If somebody needed to test, we covered them under the paid sick leave, but 1231, that's changing. Leave of absence policies, I just want to touch on this very, very briefly. Many of you, particularly who are not FMLA employers, have leave of absence policies, and you allow somebody to take time off if they need to get surgery or something like that happens. So list here some things that you want to consider. Take a look at your leave of absence policy language and think about whether somebody could use that leave of absence policy to say, stay home because their child's school is closed and they have to deal with virtual learning. Are you okay with that? What if somebody just doesn't want to come back and they maybe want to take a leave of absence for that? Are you okay with that? Are you okay if somebody says, I want to take a leave of absence because I live with my grandmother and she's at greater risk for COVID? Is that okay? Those are the types of things that you want to think about in terms of how your leave of absence policy could be applied in this situation. And just consider limiting the language of your leave of absence policy to extenuating circumstances that are beyond the employee's control largely, that precludes them from being able to physically be present at work, such as surgery, such as maternity leave. If you're not an FMLA employer, you probably grant maternity leave under a leave of absence policy. Or if somebody has to attend to personal business that is extended, that precludes them from being in the office, such as, unfortunately, they have to go deal with an out-of-state relative's estate, or something more positive. They're adopting a child from overseas and they need extended time to finalize the adoption, bring the child home, and just be with the child for a little bit of time. So just think about that when you're looking at a leave of absence policy. And discipline reviews, update them for COVID. Again, do not necessarily throw the baby out with the bathwater on this. Many of you have spent years going over your disability your discipline policies, and you're good with them and you've worked them out and those types of things. Don't throw them out. Just make sure that your discipline policy covers these following things that I have listed here on this screen. So altering timesheets, following sick and attendance policies, that late call out I talked about. 3 is very important, failure to follow workplace safety policies. That is very likely in your discipline policy now, but think about it. If somebody refuses to follow your COVID protocols, that's how you're probably going to take disciplinary action, is because they failed to follow your workplace safety. Insubordination, same type of thing. They refuse to wear a mask in your workplace. They're anti-mask. I get that. Many people are, but that's not the point. You're the employer and you can require it. No call, no show policy. Lots of people say, oh, so I was exposed to COVID, and then you don't hear from them for a week. Make sure you've got a no call, no show policy that says after a certain amount of time, they don't let you know what's going on, they could be terminated. And you want to have an employee dishonesty piece in your discipline policy. So if you do find out that somebody is stealing time from you or altering a time record, that you could discipline them for that reason. I want to just touch very briefly on employee expense reimbursement policies. This is not well covered under the law, but obviously more and more people are spending money to work from home. They're picking up paper, they have to get toner, they're running to the post office, or whatever it happens to be. You just want to strike a balance between, what is just fair. And think about whether you, the employer, are requiring the work from home such that these expenses are being incurred, or whether the employee is choosing to work from home. You also want to think about it. When you pay for something, you control it. So if you pay for the computer the employee is using to work at home, you control it. If the employee is using their own personal computer, you've got to figure out how you reserve the right. And you can do it, but you have to reserve your right to say, look, I can inspect your computer at any time because you're using it for my work purpose. Does the employee have secure networks? Again, we talked about it before, but it's critically important. And that's an expense that an employee may have to incur. So how are you going to handle that? So you want to think about that. For your employees who make close to minimum wage, if they're out spending money to buy paper or something like that, that expense has to be deducted, and you have to determine and make sure they're still making minimum wage, because if not, you don't have a choice but to reimburse. Same thing with overtime. You cannot cut into an employee's overtime. So if an employee has earned overtime, but they've laid out money for different expenses, and that means they've made now less than what they should have made with their overtime, you do have to reimburse that expense. So again, you want to think about just some overall policy components. Are you going to, if you're requiring employees to work from home, let's say, maybe you're going to have a policy whereby they purchase the items and get reimbursed. Alternatively, maybe you say you're going to hand out reasonable amounts of office supplies that you think are appropriate. Same thing with office equipment. If you're requiring employees to work from home, maybe you want to issue equipment because it helps control things a little bit better for you. If an employee uses their personal computer, I cannot stress this enough. You need to make sure that the employee understands that you may be able to inspect that computer because your work, your financial information and things like that could be on it. So it's really important to think about that. And expenses that employees incur just because they want to work from home, those typically are not things that we would reimburse. So maybe somebody needs to they want to get an extra set of cords or something like that, so they're not moving cords around every day. That's not something that we would choose to reimburse. So again, you want to look here on the screen. I've got some things, and again, we'll have the PowerPoint up, as Danielle said. Things that you want to consider, requiring receipts, pre-approval for expenses incurred over a certain amount. And the bottom one here is being able to take disciplinary action for employees who submit things that really are not for work, or they go out and they buy them after you've told them no, okay? So finally, and I thank you all for hanging in there with me, this 2021 wage and hour update for Pennsylvania. Just want to take a step back for 1 second to tell you where we came from and why this is so important. Last year, many of you were with us when we talked about, or at the end of 2019, we did our wage and hour update. And what happened then was effective January 1st of 2020, the federal government updated what's called the minimum salary threshold. And what that is the minimum amount that an employee has to be paid in order to be entitled to be exempt from overtime, meaning they don't get overtime no matter how many hours they work. So if an employee doesn't make this minimum amount, they are always going to be entitled to overtime no matter what they do. And so what happened was January 1st of this year, the federal government said, you know what, we're increasing that minimum salary threshold to the $684 a week that you see on your screen. And Pennsylvania increased its minimum salary threshold to that amount effective October 3rd, so just 2 months ago. So what that means is that as of October 3rd in Pennsylvania and under federal law, and in New Jersey, for those of you New Jersey people still hanging on, if people performed functions in what we would call the executive, administrative, licensed professional areas, those people, if they met that minimum salary threshold, they could be exempt. Here's what Pennsylvania did. Effective October 3rd of 2021, Pennsylvania raised its minimum salary threshold to $780 a week, or roughly $40,000 a year annually. Why is this important? Because the law says that whichever standard is more generous to the employee is the standard that applies. So even if under federal law, an employee might not be entitled to overtime because you're paying them that minimum salary threshold, you might not be meeting the Pennsylvania minimum salary, and you owe them overtime anyway. And the federal protection doesn't help you in Pennsylvania. So you need to be really, really careful with this. And you can see here on the screen, it's going up again, another $5,000 effective October 3rd of 2022. And it's going to reset again in 2023. And then every 3 years thereafter. So Pennsylvania is going to be way above the federal standard for who gets paid overtime and who doesn't. So important things to consider. If you're going to try to get an employee up to this level, this new $40,000 and up thereafter, you can do 10% of that minimum salary can be paid in non-discretionary bonuses. So if somebody hits a productivity level and they get a bonus, that can be included for up to 10% of the salary, as long as it's paid at least annually. You can also do a makeup payment. And we've talked about this in the past on other wage and hour issues. If somebody's at, $38,000 and they need to hit that $40,000 or $40,580 to get to that minimum salary threshold, in the first paycheck after the end of the year, you can pay the makeup payment and you'll be deemed to have met the minimum for the year. If somebody does now not meet the new minimum salary threshold for Pennsylvania, they are now going to be non-exempt and potentially eligible for unemployment if they actually work in excess, or excuse me, of overtime, if they actually work in excess of 40 hours in a work week. So you're going to have to be mindful of that. And you're going to have to basically do the math. You can attempt to reduce their overtime. You can require advance authorization for overtime, or you can just do the math and say, gosh, it's cheaper for me to raise their salary than to pay them overtime for working 50 hours every week. And so that's what you're going to want to think about, is just which is more, operationally efficient and which is less expensive for you. So I bring this out now because that new threshold amount doesn't take effect until October 3rd, 2021. But many of you are setting salaries right now for 2021. So you may want to make that change effective 1/1. If you don't set your salaries for the year until February, when everybody's back to work and you get things up and rolling, consider whether or not you want to make a pay raise. If you're going to do it, make it retroactive to 1/1. That's something you could do as well. So questions, I appreciate it. I know I've gone over, I do this to you guys every time, but Danielle, do we have any questions?
Yes, we have a handful of them.
Okay.
So if you have certain positions that are remote only positions, but you have someone that was hired for an in-person position wanting to switch to remote, could there be an issue if that is denied because the role can't be done remotely?
No, and that is a great question that gets back to all of you ELDI members who we talk all the time. I talk about job descriptions. So if you've got somebody in a job and that job is an on-site job and they say, but hey, these other jobs are off-site jobs, it doesn't matter. You were hired for this on-site job. And so you can deny that change if you want, because that's not the position they were hired for. It's just simply not the same. It's not the same job. So you can say, no, this is an on-site role. We need you here. The roles that those other people have are remote roles. And so we're not going to be able to do that. Great question.
Can you require employees with performance or conduct issues to be in person?
Yes, you can. You want to be careful about how you document that. And this gets to, remember I talked a little bit about the additional burden on your supervisors, because your supervisors more than ever are your front line of dealing with this. So you want to discuss with the supervisor, how do we know they're not performing? Not everybody has an objective checklist of things that they have to do. So it's, how do we measure? How do we know that this employee isn't performing? And if you know that, if you can figure that out, and I've got some great war stories about that, which I'll hold for another time, you can say, nope, you know what, you now have to come back for a certain period of time and then we'll reevaluate. Or you can just end their work from home because they haven't been performing.
What about suspected abuse because employee regularly says that they have to quarantine due to potential or actual exposure?
Wow, that is a great question that we could discuss forever and a day. Here's the problem. I actually was on the phone 2 days ago with somebody who we were talking about. This was an employee's third time doing this. You have to give the benefit of the doubt, and you have to rely on giving the benefit of the doubt, mainly because you've got OSHA issues if you don't. And if you have employees who feel unsafe because so-and-so is running their mouth that they were exposed, but they were made to come back to work, that's going to buy you a bigger problem. So I think you have to give the benefit of the doubt. However, as paid leave options and PTO runs out, maybe you're going to see a little bit less of that. I don't know, but you've got to give them the benefit of the doubt, and you've got to keep them out of work, because it's not so much about that employee as, what the effect is on other people and on the workplace. I would say, however, that if you have information that's available to you, like I brought up the example of somebody who went on vacation while they said they were getting tested, etc., that would be a game changer. And we could look at that and decide that, hey, you know what, you're lying and you're out. So it's kind of a case-by-case thing, but absent some type of evidence, you've got to let them quarantine.
Next question. Since the Families First Coronavirus Response Act is scheduled to end on December 31st, employees that need to quarantine no longer qualify for employer paid leave.
That's right.
If an employee needs to quarantine, they will do so without pay. Will you update us if Congress extends the act into the new year?
Absolutely. Absolutely. For two reasons. One, that's what we're here for. That's thing one. That's the quick answer. And number two, I expect that one of the reasons that the leave might not be extended is there were an awful lot of problems with determining what is a quarantine order, what's not, things of that nature. So there were a lot of things to be worked out within the Family First Coronavirus Response Act. There were a lot of issues with regard to intermittent leave, because initially that act didn't even talk about intermittent leave, and we were all holding our breath until the guidance came out. And then it was intermittent leave is possible under certain situations. And those of you who are FMLA employers already, you know how difficult that is to deal with. There was a lot that went on in that act. So if it comes back, we will absolutely update you, number one, and we would have another one of these webinars about what's changed, what's the same, that type of thing, because I expect that it would be different in probably some very critical aspects. So stay tuned, we will let you know.
Last question. If there are salaried employees, we do not track their time. How would we calculate overtime per the new threshold?
So if you have a salaried employee who now becomes non-exempt, meaning they're entitled to overtime, you can still pay the salary. You just break their salary down into an hourly rate. And so when somebody actually works over 40 hours in a work week, you break down what their annual salary is into an hourly rate, and that's how you're going to do that. You'll just pay them overtime based on figuring out what that hourly rate is. Do we have another question?
That's all the questions.
Okay. Thank you, everyone. Thank you to all of you who hung on again. I know I always run a little bit over, so I do appreciate it. I hope that I was able to answer your questions. I hope you have a great holiday season. We'll see you back. And who knows, maybe by the end of next year, we'll be able to get back to some in-person things, but we will keep you updated, and please reach out with any questions. Thank you again. Have a great holiday season. Take care.
Thank you, Kim. You too.
Thank you.